All pregnant women have lots of apprehensions. In terms of their apprehensions, at the very first visit, they ask us whether they can have a normal delivery. Yes, normal delivery is something which is very natural. It can happen with everybody without a reason for a cesarean delivery. Cesarean delivery needs a particular reason for doing that surgery. Either the head is too big for that pelvis, or the pelvis is too small for that head, or the placenta is completely blocking the lower part of the lower part, the way which the baby comes out, or there is some other problem that is coming in way of the baby to be delivered, or it can be absolutely no water level, anhydramnios, or it can be a multiple pregnancy with malpresentations, or it can be a breech presentation, head upside down. So there are certain indications why you do a cesarean. Now the most common reason why a cesarean is being done currently with the trend is a previous cesarean. So now, as of now, previous cesarean is the most common reason for having a cesarean again. We have latest technologies guiding us and giving us guidelines to go for a VBAC even after a cesarean birth. Yes, if your placenta is not low anymore, if your water levels are good, if your baby position is good, if you have no other problems like cephalopelvic disproportion, the baby's weight is ideal for that pelvis, you can still go ahead with a vaginal birth after cesarean, even after you've had a cesarean before. There are small quiet indications and contraindications to it. Your scar thickness should be good enough. You should not have any clinical symptoms of scar pain. Your previous scar should have healed well. It is not that you've just delivered a year back and you can attempt a VBAC at this time. That is not practically possible because the scar is quite weak. If your gap between the two children is good enough, then yes, you can definitely have a VBAC delivery, vaginal birth after cesarean. So there are indications why cesareans are being done. If you have to think about indications for a cesarean, you have the anatomical indications which are practically causing loss of the anatomy wherein the delivery is not possible. You have the psychological indications wherein the mother has fear for a normal delivery considering her past experience with their friends or relatives who've had painful deliveries. She carries over that pain into her life and she feels that fear and that phobia towards a normal delivery. This can be definitely elevated and it can be controlled by good childbirth education classes and Lamaze classes, wherein the Lamaze instructor gives her proper guidance about labor, delivery and childbirth. The apprehensions of a mother can be definitely elevated and she can be brought into a safe, comfortable zone to have a normal delivery, even if she is very psychic about having a painful delivery. You can still give her good education, good psychological support, good partner support and get her into the loop of having a normal delivery. Considering the anatomical reasons and psychological reasons, there are other social reasons that we are facing nowadays in terms of putting pressure on the doctor for a good time and a good date. So good time and good date cannot give normal deliveries at that particular time, because for a delivery to happen, it is nature and it goes by its own flow and time. There is no two deliveries who start at the same time and end at the same time. Even with the similar kind of parameters of pelvis, period of gestation, same body weight, same mass, same everything, they end up having different dates of delivery and different times of delivery. In such situations, having a timed delivery has become one big constraint for auspicious time and auspicious date. They're fixing a certain amount of time and getting operated rather than trying for a normal delivery. These are one of the social indications. And there's a lot of panic among people in doctors' influence in having a cesarean. But always we are here to work with the patients and give our time. It is none of our criteria to decide whether it is a normal or a cesarean delivery. We would like to give our services as and when necessary, and clinical judgment is the only thing that we give priority to. No hard push on normal deliveries, no hard push on cesarean deliveries. We always have a neutral attitude. And once if you think that normal delivery is not good for the mother and the baby, be advised for a cesarean. if they ask for a cesarean, we definitely tell that she's likely to deliver normally. Please do give her that opportunity. So it is not about more number of cesareans happening. There are certain different variable reasons for that. The most common being a previous cesarean. If you can control the first delivery to a normal delivery, the conversion of first delivery to normal delivery happens more, then the most common indication for a previous for the cesarean is a previous cesarean will automatically cut down, and maternal morbidity and mortality rates will be much better with a natural vaginal birth.